was a patient.
So this patient,
These aren't stock photos. Our team went all the way to Tijuana to bring you stories of real patients. Treated by top certified dentists in Mexico. From life-changing dental implants to dental crowns, we're breaking down the exact steps that led to these transformative results.
Was a patient here in our clinic. So this is the before and this is the after. The patients come here because he has bruxism. Size of the teeth is less than like normal size. So we start with some pictures. The first appointment, when he comes with us, we start with the evaluation. In the evaluation, we took some x-rays, some pictures, 3D scan, and then we designed like a mock-up to see how it looks with the new teeth. As you can see here, he didn't have teeth in that area, so he loves the vertical dimension. The vertical dimension is the size of the teeth. So then we start with the planning. We design the size of the tooth, the kind of the material that we need to fix that particular case. Then we place some temporary crowns to start with the rehabilitation, and then we place some implants right here. They doesn't have nothing, so we place 2 implants right here, and then we put a bridge over the implants. After that, the implants need heals to 3 to 4 months to start with the rehabilitation in that area, and then after the 3 to 4 months, we took the impressions or took the scan these implants, and then we replace all the temporary crowns for the permanent crowns, the zirconia crowns. And here we could see the other picture from the patient. This is the smile.
So how many crowns and implants did you put?
Okay, crowns, we placed 20 crowns and 4 implants, and 2 bridge over the implants. 2 bridge with 3 crowns each bridge.
Okay. So 2 bridges of 3 crowns and the rest are individual crowns. And 4 implants.
Yes, just 4 implants because they didn't have teeth in the back molars. So we use like a bridge we place an implant here in the premolar part, and then the other implant in the second molar, and then we fix that.
so this patient is like a 18-year-old girl that was complaining about pain on all of the time on her teeth. And when we took a look at her teeth, she had a big cavity in between of their teeth. So we started off with a root canal to remove all of the pain. The specialist came down. He did a root canal. It came out great. It was like an hour, maybe 40 minutes, an hour long appointment. And after that, we go ahead and did the core building up the tooth is very important. And then we did a crown prep. Okay. After that, we did a same-day crown and Emax crown. So 3 hours later, we were able to deliver that beautiful crown, matching her teeth color and everything. She was very, very excited for it and happy.
So how many appointments or how many days, can you talk about it?
This was on the same day. Everything was on the same day. It probably like 5 hours appointment on the clinic.
In this particular case, we work together with the Dr. Aylin. So we replace some fillings that are not sealing. He started with a deep cleaning because, as you can see here, we could see some inflammation. The gum is a little inflamed. So we start with the hygienic phase. Then we start removing some amalgam because the fillings are not good. And then, as you can see here, we have a tooth, but this tooth has infection and also has a fracture in one root. So we remove this tooth, and then we place 2 individual implants right here. Okay, right now this patient is healing the implants, and then we're going to continue with the treatment. Venice, I'm going to show you the before and after. Right now we replace some fillings and we did a crown. As you can see here, we could see the stitches right here because this area is healing. We placed 2 implants, and also we prepare crown right here because the amalgam was very big. So to protect all the structure of the natural tooth, we decided to place a crown in that area. And as you can see here, we only remove the amalgam and place fillings right here.
All right, so this is a patient that came to our clinic from Las Vegas, Nevada. She came with a complaint of her smile looking like these dark spots and her gums bleeding after she brushed her teeth. So when she came down here, we took a full set of x-rays, we took these pictures, and then we gave her a treatment plan which included a deep cleaning that we needed to do in order to remove all of the tartar that was in between her teeth. We start with that before we do anything else because we needed her teeth to be completely clean before we do any procedure in order to have a good outcome. So we start with the deep cleaning, numbing her on the areas that needed to be numb, and we start removing all of this tartar with an ultrasonic machine. Okay, that's how we do deep cleaning is here with us. And then there's some areas where the ultrasonic machine can go in all the way, and we use these manual scrapers that removes all of the tartar. A little bit of her gum on this area, especially from the inside, was bleeding, but it was normal because of all of the tartar that she has built up from several, maybe like 2 years that she hasn't come down to the dentist. And we did all of this polishing on her teeth, made sure that there was no tartar around her teeth. We did polishing on her teeth using a low hand piece and dental polishing paste with some of very good material to polish the teeth and make them look a little whiter and smoother, which is the aim of that treatment. After the teeth deep cleaning, we needed to start with the fillings. So we start removing some of the fillings. One of the difficulties that we had is that the fillings were very close to the gum line. So it took us maybe like 4 hours to finish with all the fillings, but as you can see, there are many. There were approximately like 10 teeth that were filled on that appointment. The patient kind of like, she got tired a little bit, but we usually give them breaks around like 10-20 minutes breaks so they can relax, and then we can start again with the treatment. So it took us probably like from 12 p.m. all the way to like 6 p.m. After the treatment was finished, we did a teeth whitening, assumed teeth whitening, which included 4 sessions of 15 minutes each. And it has a light that helps with the teeth whitening to improve it or to boost the teeth whitening. And that was it. It was a 1-day appointment. She came all the way from Las Vegas, and then she came back the same day with a very beautiful smile.
So we'll talk about some cavities that this patient has in these borders. So as you can see here, these like stains right here are cavities. We took some x-rays to see how deep is the cavity, and then we start with the fillings.
So what are that iron? What is that metal thing around the teeth?
So clamp is to, as you can see here, this is a kind of plastic right here. This is a rubber band to protect or to avoid that contamination between the saliva and the tooth, and to avoid that the cavity that we remove goes inside of the patient. That's the reason that we use a clamp and a rubber band to take all the tooth. We protect the tooth, and also we avoid the contamination with the tongue and with the saliva inside of the tooth to make a good sealing of the restoration, the final restoration. Here we could see the tooth without the cavity, and now it's filled. Rubber down in the clamp that's still here in the tooth. After that, after we fill the tooth, we remove all the protections.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.